Okay, so I'm going through the assignments right up there. And one of the ones that someone has asked about specifically is getting the information on this stuff up through here. And I'm going to explain it all, and we're going to go through it piece by piece so you have a better understanding. There's some tricky questions in here. I don't like the way that they're written. This is a little bit in depth and not the greatest, but I mean it's a good test. I mean it's a deep test, but I mean this is stuff that I know, so or at least have a good idea of. And remember, you can always hit that button at the bottom that says check, and it'll give you a check on those too, so you can start to understand them better. And that's the idea of the whole thing. So let's go through and look at this diagram first. Okay, as I have my, let me squeeze this closed here. Oh, actually, that was kind of cool. There we go. So I'm gonna rise this up, and we're gonna go through this entire little diagrammy of things. So on this side over here, that's the heart, obviously. And remember, the heart has 4 chambers. It has a few vessels along the front of it. Those can be confusing in this case, but they're trying to give you a reference value. And over here, this is the central nervous system. This is a brain, and this is like the medulla and the pons and the spinal column. Okay. And so we're matching spinal nerves and cranial nerves, right? Cranial nerves are important here, especially cranial nerve 10, which is going to be the vagus nerve, right? And that's going to give information out and in. And here we have a couple of things to look at. So number one, we're looking at, and I'm going to guess, this is like medulla oblongata, probably, because that rules heart rate. And notice there's information going out and there's information coming in. Now that's part of the parasympathetic parts too, right? Parasympathetic nerves come from the base of the skull and the sacrum. We don't show sacrum ones here because it's a little far away from the heart, actually. And remember, the sympathetic chain is right along the thoracic spine. So let's go out here and let's just do a little bit of a brief look at these things real quick. Arrows going back are going to be afferent or sensory. Arrows going away from the central nervous system are going to be efferent or motor. So we have 3 of those and 2 of these returning ones, right? Now, other anatomy stuff we have in here too, we can see, and this is the aortic arch. Remember, that goes back down behind and then serves everything out there. And then it has some branches that go up. It's going to be subclavian, the carotids, and come up here to this carotid here, right? The number 10, that's going to be the carotid sinus or the carotid plexus. Now, there's a baroreceptor there, and a baroreceptor means that it receives information sending back to the central nervous system about pressure. So if you have too much pressure in your heart, your heart's pumping too hard, it'll stimulate that. And then what happens is that'll send information to the brain. The brain's going to say, whoa, calm down, so we don't have a pop a gasket, have a heart attack, those kind of things, or a stroke, right? And if we're in nursing world, this is kind of like a little more in that world for you guys. If you're in nursing world, if someone's having the symptoms of a heart attack, easy thing to do, and this is in the CPR manual and the CPR classes, is to give them some baby aspirin, the 81 milligrams. You can give them up to 4 and have them chew them right there in front of you. If they have nitroglycerin, which like I've shown before, I can take that. I've only taken it to see what it's like. I didn't really take it because I needed it, that's good, right? Anyway, let's go through these. We also have here, that's the carotid sinus. Down here we have these 2 little circles or bubbles. We're going to call this one the sinoatrial plexus, right? So this is the node, sinoatrial node. A node is a little section of a glob of neurons, right, that send information somewhere. Now, these are going to send it into the heart for the rhythm of the heart, number of beats per minute, right? The second one down there, that's number 8, and number 7 is called the AV node, the atrioventricular node. So it's between the atria, which are the 2 top chambers up through here, and the ventricles, which are the 2 bottom big heavy hitters down the bottom. Okay, so these send information back and forth. Down through here, number 3, it looks like that's probably going to be, we're talking about other vessels that have contractility. That's a smooth muscle if we're going way back in the machine. And those are under sympathetic control as well. So if you get sympathetic control, what happens is it increases your blood pressure so you can get it going and go do things, right? So let's go through the answers real quick. I just want to give you some information on this one. Okay, so I have them here. Let's go. See, sympathetic nerve stimulation causes vasoconstriction, which determines SVR. And so if you put in there determines SVR, that's going to be, which I looked at, the systemic, right, vascular resistance, okay? So there's a few things, where did my picture go? There we go. Where did my picture, so there's a few things that cause blood pressure to go up. Volume changes. Volume changes can mess with your pressure. If you drink a lot of water, your blood pressure is going to go up a little bit. Not a whole lot, but it can go up a little bit because you haven't peed. You have too much volume in there. That's hypervolumic, right? And the other one would be constriction of those or pressure of the heart. Now there's maybe a couple more in there. I can't remember off the top of my head. But also sympathetic control. If you're stressed out, everything tightens up. Right? You're like tightened it up, right? So this one here is going to be, I'm going to guess number 3, because sympathetic nerve stimulation causes vasoconstriction. Vasoconstriction, we're talking about these vessels. Vasoconstriction determines systemic, right? Here's systemic. So we're not talking about the heart, right? So we're going to go down, and that's going to be number 3, which is great, right? The next one, okay, and I'm going to have to go bounce back and forth through these, so bear with me. Number 2, sympathetic nervous system. Remember, sympathetic nervous system, in through this section right here, increases heart rate. 4. So it's from there. See, that's why this is hard. So it goes from there all the way down the sympathetic chain to increase the heart rate. There's the heart. It's increasing the heart rate. Okay. Number 3, it says autonomic stimulation is interpreted by the medulla oblongata. Okay, so that's right. There we go. Okay. Autonomic, that's, okay, autonomic is automatic, right? Stimulation is interpreted by medulla oblongata. It's telling you where it is. Medulla oblongata. Let's go up here. Bing, bing, bing. There's the medulla oblongata right in the brainstem. Okay. Last one down here, not the last one, number 4. Let's go to number 4. I gotta really move this over a little bit. There we go. Number 4. Carotid baroreceptors. We just talked about those, yeah? So carotid artery right in through here. Bing, bong, boom, right? Number 10. If that says number 10, then we're in business, right? Where are we at? Gotta go down here. Number 10, carotid baroreceptors. Number 5, sympathetic stimulation causes a chronotropic and ionotropic effect. Sympathetic stimulation increases one's force of myocardial contraction and for blank and blank. Terrible question, in my opinion. So we have a couple things we have to figure out. We have number 4. We have sympathetic stimulation causes, number 4, there's sympathetic stimulation, right? And increases force of myocardial contraction. This is why it's terrible. 4 and 6 are the answer. See that? That's hard. It's almost, I had to do that one last because I had to like eliminate everything else. But then I realized that in this, there's only, we have 14, 15, 16, 17, there's 18 answers, and there's only, 11 choices. So some of them are going to be reused, right? So this is kind of the strategy of taking these kind of quizzes. Number 6, let's go down here. So that's 4 and 6. Number 6, CNS, cranial nerves, 9 and 10, carry baroreceptor, right, information to the medulla oblongata. So to the medulla oblongata, which is to the central nervous system, right? And we're going to look up here. There's number 11. So we had, what was the ones we talked about here? If we look at it, we have, come on, let me get down there. Number 11, carry baroreceptor information to the medulla oblongata. Central nerves to the medulla. So anything going to the medulla oblongata is going to be up here. We're going to find it. Hey, look at there. There we go. These 2 up at the top, that's 11. These are autonomic sensory to the medulla. There's medulla, number 1. Okay, going on from that one. Number 7, vagal stimulation, right? This is cranial nerve 10. Decreases the heart rate, rest and digest, right? Vagal discharge affects the sinoatrial node, and AV node, right? These motor fibers are a part of the cranial sacral flow. So It says craniosacral here, right? Craniosacral, which I talked about before, had to do with the part of the autonomic nervous system called the parasympathetic, cranial, right? Come out of here, and then sacral down to the rump. So this one is number 5. Let's look at this where it is. There's number 5. Now the hint it gave you was the SA node, right? The AV and the SA nodes, right? And we'll see that down here. Watch. I'm gonna go down here to that one. Okay. Down here, vagal stimulation decreases the heart rate. Cranial sacral flow. So this could also get you messed up. It kind of messed me up because there was nothing from the sacrum. It didn't talk about the sacrum in there, but the sacrum's so far from the heart again, it's not going to matter. Aortic baroreceptors. It tells you where it is. Aorta. Bing. Right there. Aortic baroreceptors. Where are we at? Fibers are part of the thoracolumbar outflow. So it gives you thoracolumbar. Thoracolumbar. Let me get this up here actually so you can see it. Thoracolumbar, that's the sympathetic change. And their motor, it's going to be 4 and 3. Let's see if we got that right. 4 and 3. Yay us, right? Now let's go down further. How can I see this more? I can't see more on this thing. Let's go Control minus maybe. Can we do that? Nope. Control plus. Let me see if I can get down to the bottom because I can't see what's going on here. Okay, there we go. Okay, we got to do this one then anyway. So where were we here? So we are at the SA node, the pacemaker, right? There's our SA node. We knew that one because we talked about it, right? SA, sinoatrial node. So it's sino means like around, and the atria are those top areas of the little chambers, right, that pump into the ventricles. Let's go down here now. That's the sinoid of the pacemaker. That's what SA node is called, the pacemaker of the heart. The AV node is the next one. That's another one of those things. That's up here at the top. SA node, AV node. Let's see if we got them right. That should be 8 and 7, 8 and 7. And then number 14 here, the last one. Whoops, let me get down here for you. There you go, AV node 7, sorry. Origin of the sympathetic nerves that transmit responses to the heart and arterioles. Arterioles and heart, it'll tell you from there, and it's sympathetic. So sympathetic, we know, comes from up here, right? Or sympathetic comes from this section here, the thoracolumbar. Coming down here this way, it should be, where's our number? Where's number 2? So, God, the origin, here we go. That's the key. Oops. Show you down here. I'm trying to like scroll back and forth. It's hard. The origin of the sympathetic nerves. There it is. That's the question it's asking. There's the origin of the sympathetic nerve. So there we go. I mean, that's like 15 minutes. Sorry it took so long, but I had to scroll back and forth and stuff like that. I hope this helps you. This is for currently now, whatever the class is. So I'm going to go have a cup of coffee. I suggest you guys go have a cup of coffee. It's the beginning-ish, mid part of week 3 or 4. We're in that stuff. I think this is for week 4. Actually, let's go up here and check. This is week 4 quiz, so we're even ahead of the game. I'm gonna mark this off and send it in a announcement or email or something like that for you guys. And it's under 15 minutes. So remember, my hints is go back in your discussions and add something with that's good for it. And then 2, when you're doing these things, read everything carefully. It's hard to go through them really fast, and that's by design. This is supposed to keep you working and keep you active in it, right? Other than that, I just sent out, it looks like mid-mod advising forms for some of you who needed a little like push and whatnot. That's okay. We'll figure it out. If you're having trouble, just let me know. There is tutoring. I'll have to repost that whole thing as well. And oh, don't forget, I mean, you've already watched the video, so it's kind of stupid for me to tell you now. But if you go down to the bottom, right down here, right down there, right down over there, you can hit the little gear, and you can say speed and go 1.5, and I'll talk really fast, and everything will go really fast, and I'll get through the whole thing really in like 15 minutes. Oh, sorry, not 15 minutes, like 7 minutes, whatever, okay? Anyway, talk to you later. This is Dr. Sean over at Fortis, and have a great week, and do good, be good, and all that fun stuff. Talk to you soon. Bye.